My mother, who just turned 77, has both Alzheimer's and Parkinson's. She has 3 daughters, but lives with me, the middle child, along with my husband and my son, for about the last 5.5 years now. She first started to show signs of Alzheimer's, I'd say close to 10 years ago. She was in her late 60s at the time. I first noticed it basically in her cooking. Ma loved to make all the big Italian dinners and always feeding everybody, and something was just off in the taste. Probably forgetting the recipes. Typically Alzheimer's symptoms and the way doctors kind of categorize a person's stage in the disease is kind of based on their ability to handle activities of daily living, as they call them, ADLs. Basically, even before they get to the basic activities of daily living, there's what they call instrumental activities of daily living. So those are the food preparation. Can they do laundry for themselves? Can they write out a check any longer? Any of the financial matters? Go to the food shopping? Use a telephone? Or do they remember how to take their medicine or what they're supposed to take? Can they drive? A lot of those things you can kind of get around them. Obviously you could get somebody to come in and do house cleaning or do the shopping for them, or get somebody to drive them places. But when you get to the point where you can't not only do those but what they call the basic living, it's really a sad state. And those basic items are can they eat? Do you have to cut up their food? Sometimes we even have swallowing issues now we're starting with, but also too, how about their bathing, dressing, toileting? Can they do that for themselves? Are they incontinent? Can they stand up and get in and out of the bed? Do they need somebody to kind of walk with them all the time? And at that point, they're not really safe to be at home, alone, I should say. So there's choices then. Medications that are typically prescribed pretty much vary with the different stages of the disease that somebody's in. There's not actually any known medication out there that can stop or prevent the disease. At best, the only hope is that the disease may get slowed down as a result of taking the medicines. She's taken 3 out of 4 of the medicines that are even on the market, and the 4th is actually something that she's not even a candidate for, because that's an early stage person, which she has kind of long surpassed at this point. Unfortunately, we really can't tell if the medicine has done any good, because what we will never know is how she would be if she never took them at all. It's kind of a little bit of a gamble here. We know that some of the medicines don't agree with her in terms of making her very agitated, hitting, poor sleeping patterns. Usually when we try something, there's bad side effects. So some of the other things that we've seen has even been hallucinations and confusion, further confusion, I should say, as a result of trying different meds. And also, in Numa's situation, of course, it's a little more complicated because we're trying to treat 2 illnesses. So she does take medicines for the Parkinson's as well. And whenever you're dealing with more than one, you've got perhaps medication interactions that complicate the situation more so. We're at the point right now where we see that less medication, we say less is more at this point in terms of the effectiveness. The side effects versus little, if any, benefit really don't sit well for us trying anything new. I would kind of look at each medical need currently and how to treat them in terms of how it will impact her quality of life. I'd say for me, as the daughter, the hardest part of the disease was accepting it. Numa was always so active, quick-witted, very bright, worked in a medical school for 3 different deans. She helped with editing my MBA thesis. She juggled family and work with no problem. She was active physically, always playing tennis. She was, she was the one in the family that everybody else looked up to for help. And even after retiring, she kept busy, still going to the gym, still playing classical piano, very involved with the grandkids, and just seeing what she can do for everybody else. She didn't fit the mold of people getting this disease because they sat around idle. And of course, when this disease came on, I wanted to believe that I could fix it. I knew much older people than her who were very sharp still. She was only 67, 68. My thinking was that if she wasn't living alone and had the activity of a family going on around her, this would keep her young. But she wasn't ready to give up her independence at that point. Never wanted to be a burden on anybody else, so she wanted to stay in her place. And we allowed that to take place as long as we could. She kept her gym routine, lunch dates, piano lessons going on. We did try to push her to keep busier in the days while everybody else was at work or school. We suggested she join senior citizens, but it's amazing. They all think the same way. That's for old people and out of the question. Little did she know that she'd never even be able to keep up with them shortly thereafter. I would check in on her daily, help her around the house every weekend with cleaning, and then take her out somewhere just to make sure she wasn't as alone as much as I could. But she did become more afraid to drive places, and perhaps that was a fear of getting lost, because a lot of them do that. I would pop in on my way home from work some nights and see that she was probably crying. It definitely had that look of crying and depressed, and it would be dark, not the windows wide open. She wasn't eating right, a lot of frozen dinners, and she wouldn't know what day it was, and she definitely wasn't taking her medicines correctly. Basically, for every situation we would uncover, we tried to find a solution, bring her food that we cooked, or sign her up for adult day program to get her out, manage her medicines, tape the buttons on the remote control so she could change the channel and volume without knocking the TV off herself, but it just keeps progressing. I started having her spend the weekend with us so I could get some of my own things done at home, and she really seemed to like that. I do remember, though, however, one Friday night when she wasn't coming over because she had plans on the Saturday, which happened to be Christmas Eve. And, of course, then Sunday would have been Christmas, and we were all going to be together at Aunt Barbara's house, my sister, her daughter. I happened to stop there anyway on my way home that Friday, and she was standing there all dressed for Christmas Eve, hungry. She hadn't eaten yet. She was wondering when her ride was coming. And then, I explained it to her, that it's not Christmas Eve yet. She just said to me, "Oh, don't tell anybody I did that." She was a funny lady, and she would always just kind of laugh at her mistakes, but it was more than just making mistakes. It's different to mix up a Thursday and a Friday or something like that, but I just thought it was really serious to mix up when Christmas Eve is or Christmas Day, So, unfortunately, just being in, by the next Christmas, she did somehow agree to move in with us. But unfortunately, just being in the house with other people didn't stop her decline. At times, her decline seemed more rapid than others. She wasn't putting her shoes on the right feet or even able to pick a pair of matching shoes. She might have a slipper and a sneaker or something, and clothes were going on over pajamas, inside out. She'd forget to rinse the shampoo out of her hair. It was sad. It's still sad. I wanted to teach her how to do everything again, but in doing so, this only frustrated myself. I'd get mad that she wasn't doing these things the right way, even as I stood over her telling her, the sock goes on first, and then she'd attempt to put the sock that I'd say, put this on first, over the second sock, you know. It was almost as if, you know, is this for real? You know, I was just losing my patience, and then I'd feel so guilty that I did. And then, you know, even though I could talk to you, John, or Daddy about it, you know, and we'd laugh at it after the fact, when it was going on, it was, you know, making me crazy. It was on me to get her dressed, and I just didn't know what to do any longer, you know. And then the following morning we'd go through the same thing, thinking, well, I just finally taught her, couldn't get ourselves out the door to get her to daycare so I can get to work. I mean, you just don't know what to do at certain points. I really couldn't accept her in this condition. She was no longer the mother I always had. You know, I wanted to be able to fix things so we can get her back. But eventually what wound up happening was that I was the one who had to learn to accept the situation. I had to no longer try teaching her and just give in to the fact that I just had to do it for her, which probably didn't make it any better. I mean, I can't say it made it worse, but I guess the benefit was my psyche probably just to say, you know, okay, this is the way it is. This is what we have to deal with. I mean, it's shocking to think that today she doesn't even know what the word sock means, or can she say even the word sock? She has aphasia, lost her ability to communicate. I mean, this just keeps spiraling downwards. Likewise, she's just too far advanced in her disease to attend adult day school any longer. She doesn't know me by name, I would say. I think she knows that I'm a familiar face. She's not scared of me. When she was able to last speak, she used to refer to me as her mother. But today she doesn't seem to look for me when I'm not around, I'd say. Whereas before she would kind of go into a panic whenever I left the house. The decision for us, yes, that question as to how we decided to keep Numa with us and not place her in a nursing facility, well, that was made for a couple reasons. First, we knew she would get better one-on-one care at home if we could just bring in help compared to in a facility where the number of patients to the number of staff they have, that ratio is just so much higher. Second, we knew we could have a closer watch on her overall safety and well-being. We knew the things she likes and what she doesn't like. You know, she wants her coffee and chocolates and going to church and being around family. They can't handle that for everybody. You go see these places, and there is a big difference between a assisted living and a facility. And she was certainly, even at that point, beyond an assisted living situation. Third, probably most importantly, what swayed us was that she was just this wonderful mother, grandmother, mother-in-law. Everybody just loved her. And if the tables were turned, we knew that she would have died trying to take care of any one of us in the same condition. And I also have to say that if it wasn't for Daddy, it wouldn't have happened. There have been many sacrifices and life changes we have all had to make in order to accommodate the ever-changing situation, and none of the other siblings and their spouses were willing to take it on, and I understand that. Daddy just has a very strong conviction for helping others and not giving up, and I credit it solely to him. That's not to say that this comes easy for us compared to anybody else. It certainly doesn't. We've had to move to accommodate the living arrangements, and I know that was not an ideal time for you, John, in your life as you were just starting high school. I apologize. I was not able to give you and Daddy as much attention or help that I would have liked to, because now I had to split my time further with another person. I was no longer able to juggle my full-time job along with caregiving, and had to stop working outside of the home So that certainly was a big change as well. And we had to also start getting used to different agencies and home health aides coming to the home, which causes us to lose some of our privacy and family time, but we needed to start bringing some help in for different situations. Plans around vacation or even just what to do over the holidays are never easy. Her behaviors and capabilities are kind of much like that of a 2-year-old now. In fact, her 1.5-year-old great-granddaughter, who she really never knew, surpasses her in many ways. The 1.5-year-old can at least follow some directions and learns things daily. But this is not the case with Numa. Her ever-changing condition is depressing to watch for those of us around her, and also a worry for us too, if this is what our future holds. But both her father and her brother had this condition, and while they don't know enough about the disease, the medical experts do claim that it is hereditary. As far as what support is available to me, that's a good question. It's probably like most things when people say, let me know if I can help you in any way, or just give me a call if you need anything. It's not likely that you will take people up on it. Perhaps in this situation it might be because of how quickly you need to respond to a situation. Say she falls in the bathroom or tries to run away outside, although we're kind of pretty much past the wandering stage right now. Or say she decides to start moving chairs around while you're trying to stand over the stove and make dinner. Those are the things you just have to be on your toes for and jump into action on. And at other times I had the situation where I did ask for help with getting somebody to watch her so we can attend an event, and we were really disappointed. I felt like we were in it alone. I knew if we ever gave up on her, she would get placed in a home. Besides you and Daddy, who can give me a break and keep an eye on her for me to, either just go out and take a walk or jump in the shower, we've learned that we have to look outside of the family for resources. I did go to some Alzheimer's support groups, which are extremely therapeutic in knowing that you're not alone in going through this. And that the feelings you struggle with are nothing to feel guilty about. I mean, sometimes you kind of get mad at yourself for how you're feeling, but it is normal. I've also become a member of the United Way Caregiver Coalition. They have one in Morris County. There's probably about 500 members in it right now. While most of us, of course, can't attend the meetings due to the caregiving responsibilities, they still have options where you can read the meeting minutes or get resource information virtually online. But this isn't quite the same as the support group. However, it is very helpful, not solving individual problems, so to speak, but they'll it's a lot of resources. They can give you information on the adult daycares available, home health agencies, home modification companies. You have to put in grab bars, or maybe you need to put in chair lifts or other things there. They can tell you about different specialists. Geriatrician, we got a geriatrician, never knew they existed. It's kind of much like a pediatrician. Legal assistance, And another big part of this group has to do with advocacy. This coalition works hard to pass bills and speak up on items such as Alzheimer's research. Not enough being done about it, or mandatory need for seatbelts on public transportation for wheelchairs. They get involved in that kind of item because. This coalition actually doesn't support just Alzheimer's. This coalition is for all caregivers, so not specific to even just the aging. In fact, when I hear about somebody who's caring for a child and it's not an elderly person, my heart really goes out to them. I certainly see their journey to be much more difficult one than mine. It sort of put things in perspective for me and stops me from complaining or feeling sorry for myself, kind of like the saying, you know, I felt sad that I had no shoes until I met a man with no feet, you know. I do feel that I've learned a lot about human nature during this time with Numa, and hope to always remember what others might be struggling with and offer a kind word or even just an ear to listen to somebody else. But certainly both support groups and coalitions have been invaluable to me, and they're both really focused on the caregiver and not the patient, which is very, very important. They both stress the idea of caring for the caregiver. And while caregivers tend to always put others before themselves, it is so important to make time for yourself. I do feel better when I can get a breather. You know, the coalition runs a caregiver cafe like one evening a month to get caregivers to come out and take a couple-hour break. And they'll also get some of the local healthcare agencies to even provide complimentary care during that time to get the caregivers to attend. One of the best analogies I've heard on this topic of caring for the caregiver is the example of when you're riding in an airplane with a child. If there's an emergency, they always tell you, put on your own mask first before you assist the child that's sitting alongside you. You know, likewise, as a caregiver, you know, you need to know that if you don't take care of yourself, you're not going to be able to care for that loved one. And while it is hard for me to follow the advice, I do know that it is the truth, and it's the best advice I can offer others who are going through that same situation. Just last month, as you know, we started to have a live-in join us for 7 days a week. We have permanent live-in now, and which I guess it's pretty good. You know, it's 5 years into it with her living with us, but certainly no privacy now. But physically, I just couldn't do it anymore. We say Numa has become a two-person job these days, so I really still am involved with her care, but less so for the hands-on bathing and toileting issues, which is a huge relief on my back and mental health, but I'm still very much with her and in the home with her at most times. Alzheimer's is just a horrible, horrible disease. It just robs the person of their faculties and dignity, robs the family of their loved one, and I always found it very sad to hear the disease referred to as the long goodbye. I was always somebody who hated goodbyes and would always avoid them at all costs, and now I have no choice, you know. As the individual deteriorates, the family around them is constantly dealing with emotional and psychological issues.